Well, anatomy crew, we are done with anatomy of the arms. We made it the whole way down to the phalanges of the fingers last time, so this time we are on to anatomy of the legs. Like when we started arms, we're going to start with the girdle for attachment. We're going to talk about the pelvic girdle today. Quick set of notes, just the overview of the pelvis, not a ton of features, some really large ones and some really important ones, and then we're going to look briefly at the difference between the male and female pelvis. We've talked about that in passing before, the differences between the genders based on baby bearing, based on the structural ability of the female to carry a child, the different organs that support this function, and the shape, because that's awful big to fit out something awful small. So we're starting off with the pelvis in general. Let me move my notes over. When you're looking at the pelvic girdle, much like the pectoral girdle, its main function is a point of attachment. For your pelvis versus your pectoral girdle, though, the muscles of your legs are a lot larger, bulkier, and stronger than the muscles of your arms. The pectoral girdle is delicate. It's lightweight. Clavicles are small, scapulae are thin. Even the spine of the scapula, your largest feature other than the socket, ain't much. When you're looking at a pelvis, you are looking at something that's able to hold many muscles and a lot of muscles that are strong. If you can stand on your hands, you are in the minority. Your legs are meant for standing. If I asked you to curl, my best guess is that you could squat more weight than you can curl. Legs are stronger than arms, so they need a stronger point of attachment. Your pelvis is two halves. It's two bones, and each side is one bone with three regions. Ilium's the top. If I put my hands on my hips, that's my ilium. The iliac crest is the top ridge you can feel. If I sit down, the part that hits the chair is the ischium. You can see in that picture that there are definite protrusions, sticky outs on the ilium. If you've ever been riding in the back of something sitting down, I did this when I used to work at the golf course. I was sitting in the back of a John Deere Gator when my friend went over a hill. I went up and back down, and both of those bumps, boom, right on my butt, on the back of the cart. And they bruised, because there's parts that stick out of the ischium. My professor called those the sit bones, because if you've ever bruised them, you know. The pubis is the anterior portion and the root of the definition, the descriptive term pubic. So you know where that is. And there's not a lot of features of that except the cartilaginous joint in there. So major features of your pelvis, this first one is the big guy, the acetabulum, the hip socket. Acetabulum is one of those words that's like unnecessarily large when I could call it the hip socket. It's pretty cool though, because if you think about the shallowness of the shoulder socket, I told you the shoulder was pretty much just like that. The hip socket is very deep, and that's why the hip is anchored more firmly and less flexible in general than the shoulder. When I had anatomy class in high school, there was this kid in my class and he was real normal. We thought he was normal. Like, everybody would talk, and of course there were weird kids in there. But he was just like, okay, cool, I'm doing my thing, and the teacher one day goes, exactly what I just said. Your hip is less flexible than your shoulder, and he looks at her and goes, wanna bet? And we're like, why is this kid talking? This kid doesn't talk. She said, yeah, your hip is anchored. Your hip isn't meant to go up over your shoulder. And he goes, uh-huh. He puts a pencil above his ear, slides over in his chair, takes his right leg, and I'll never forget, shoves his right leg out in the aisle. It was tables like in Mrs. Wilson's room, Mr. King's room. Takes that foot and goes straight up over his ear, all the way around. It wasn't just like this way. He went up around the back and knocked the pencil off his ear and proceeded to scratch like a dog. We thought he was normal. He's a teacher now. But that's why I'm saying most people have less flexibility in the hip than the shoulder. Dancers, people who can do splits, anybody you've seen do that does have a pretty flexible hip joint. Like anything, you can train the muscles to be more flexible. But in general, hips don't do this. This is a shoulder thing because of the shallowness of the glenoid cavity versus the acetabulum. You also have a lot more ligaments holding the hip in place at the acetabulum than you do the shoulder at the glenoid. Bulkier ligaments, things designed to make you not have a pinwheel hip. Acetabulum is Latin for vinegar cup. I don't have a vinegar cup. I have vinegar and I have cups, but I can't think of a cup shape that's specific to vinegar. I guess in old Roman households you might have, but good for you. The iliac crest is the top of the hip. It's where you put your hands on your hip. That's the iliac crest. You can feel the ridge. The obturator foramen is a mean trick based on what we learned earlier. We talked foramen magnum. Big hole underneath the occipital, big. The obturator foramen is bigger. So we named this thing in my head big hole, but the hole in my the hole in my pelvis is bigger. The obturator foramen is where those bumps are on the ischial region. The bumps on your butt are the outside edge of the obturator foramen. It's the same as any other foramen with structures passing through it. But in this case, when we look at the muscular system, you'll see muscles actually anchor on the ridge of the obturator foramen. And you have things like your piriformis, a muscle that rotates the hip, that goes through. So it's really nice. Where we've been sticking muscles on the surface of things onto projections before, onto processes, the foramen gives you like the edge. It actually gives you a really solid grip for the muscles of the gluteal muscles and the muscles of the thigh. Symphysis pubis is a cartilaginous joint. There aren't many. We get to see one. It's between the two halves of the pelvis in the front. If you've ever had anyone move, if you've ever seen anybody move around and say, my hip kind of cracked in the middle, that's an air pocket at the symphysis pubis. It's a cartilaginous joint. Very little motion, but still a place where two bones meet. The anterior superior iliac spine is a major landmark of the pelvis. It's out here in the front, on the front of your hip, and it's a spine. It sticks out. Runners often get something called snapping hip syndrome, where a ligament or tendon is going across that ASIS, anterior superior iliac spine, and it'll snap if you rotate your hip. It's usually painless. Sometimes with swelling, it will get more painful, but in general, it's a disgusting feeling and an unsettling noise rather than something that's painful. It's one of those things, rest, ice. You can't really compress or elevate too much, but the rest and the ice will often take the swelling down. Some people recommend ibuprofen for it, but snapping hip is more icky than painful for most people. We're going to look at the lateral view of the pelvis. You can see the acetabulum and the obturator foramen in that side view. Ala means wing. So anytime we get a large flat portion like the top of the hip or the sides of the sacrum, we call them ala, wings. Comparing your male and female pelvis, pelves is plural pelvis because pelvis is kind of awkward. What I'm going to say about the sizes of the pelvis is that I bet that they're based on average size. The average height for a female is around 5'3.5", and the average size of a male is around 5'9". I definitely know more people who aren't those heights than who are. So if you were to compare a 6-foot-tall female and a 5'4" male, you're not going to see this size comparison. You're going to see the shape comparison. But I wanted to note that if I were to stand next to a guy who's 5'7", our pelvis itself wouldn't be that different in size. It would be more different in shape. So your pelvic inlet and pelvic outlet are labeled as, I don't think they're on this picture. I'll see if I can find another link that shows you inlet and outlet. I tried to find those, and it's pretty much exactly what you'd expect with the inlet going across the front and top, and outlet out the back. The pelvic inlet is large and oval in females, and narrow and heart-shaped in males. When I say heart-shaped, you can see the heart on the front of the inlet just being the forward part. That's my dog going upstairs to bed. Yeah, it's 9 a.m. The dog just went to bed. It's going to be a good day. Pelvic outlet. The back, wider in females than in males. Both of those first two characteristics are based on the need for the uterus to be able to hold a baby in the pelvis and for the baby to be born. Again, the pubic arch, U-shaped and wider versus V-shaped. If you study running, which I did for my master's, one of the things that we noticed was that females' legs tend to be set out wider than males. It's called the Q angle, and the set at the hip comes from the width of the pubic arch and the width of the pelvis. The female's legs tend to angle out more from the hips than males. I see that when I watch running, that in general, females' legs are out more, giving and then an angle back in at the knee. That comes from the width of the pelvis. Sacral tilt. The sacral tilt in a female, remember your sacrum, the bone between the two parts of your pelvis, is curved backward in female and is straight up and down in males. In terms of shape of the pelvis, it's visible from the outside. This is why often you can see a more pronounced curve going backward at the sacrum on females than males. People say that that's girl butt versus boy butt. As I'm saying that, you probably know what I mean. The general curve to that region of females is more pronounced than males, and it's because, you can see in that picture, the sacrum points out more in females than in males because of the pelvic structure. Oh, I do have a link at the bottom with the better look. So if you follow that link, you'll be able to see more about the inlet and outlet, I believe. I was not happy with how they were labeled on this picture, so I put that at the bottom. Hopefully that helps. So your takeaway message from today: pelvis holds on your legs. It's totally designed for the hip to be stable and the muscles to attach to it to further stabilize the hip. The socket depth and the muscular attachment serve that purpose. Male and female pelvis are different, primarily females being baby-bearing versus males who are not, and the structure and shape correspond to that. So there you go. You can go to bed now like the dog. Have a good day.